Thank you to all our subscribers. I just want to use this word to say thank you for subscribing, thank you for liking, thank you for all your comments so far. Thank you so much. We really appreciate. Yeah, welcome back to this channel. If this is your first time of coming across this channel, this is where your health matters with Elizabeth, where we give you all the necessary tips on how to take care of your health, how to manage your health, manage any type of disease you're suffering from, how to live an healthy life, how to live a healthy lifestyle. Are you looking for a channel like that? You're at the right place. So sit back and let us dive into what we have for today. Today we'll be looking at a condition that is common among men, but it's a kind of condition that men are scared to talk about. They are shy, they are embarrassed, they don't want to talk about it. They just be like, no, I can't talk about it. No, it's shameful, But no condition is shameful. Nothing that is doing you in this life is shameful. You just have to come out so as to find solution to it. If you do not come out, it will be a lifetime thing. That it might get to a critical point that you'll not be able to treat it all. But so, whatever you're going through, either male or female, don't be shy to talk about it. Don't be shy. Today's topic is erectile dysfunction. ED, it's commonly known as ED. Impotency, impotence, different name for it. So what we'll be looking at is erectile dysfunction. Erectile dysfunction is the inability to get or maintain an erection long enough to have sexual intercourse. It is a type of penile disorder. Your feelings plays a major role in getting and maintaining an erection. Feeling relaxed, confident, and aroused is very essential. If your feelings are not in disorder, to have erection can be difficult sometimes. In many cases, erectile dysfunction can be the first symptoms of another underlying problem, including heart diseases. Erectile dysfunction can be another, is a sign of another condition sometimes. It is important to talk to your doctor, to talk to your health practitioner if you have problem getting and maintaining an erection. There are so many other names they call erectile dysfunction. It can be called impotence or impotency. We'll be looking at the types of erectile dysfunction. We have the vascular ED, we have the neurogenic ED, we have the hormonal ED, and psychogenic ED. We'll be looking at it one by one. So get your book and pen and write it down if you want to. Vascular erectile dysfunction includes causes that affect the blood vessels that send the blood to the tissues in your penis that allow you to get and maintain an erection, or the valves in the penis that normally hold blood inside. That is, it affects the blood vessel that makes you have erection, or the valves that also helps in maintaining an erection. It's also the most common type of erectile dysfunction. Vascular erectile dysfunction is the most common type of erectile dysfunction. Neurogenic erectile dysfunction occurs as a result of nerves problem, which prevents signals from traveling from your brain to your penis to create an erection. This can happen because of so many things. Can happen because of trauma, pelvic surgery, radiation therapy, or neurological conditions like stroke, spinal stenosis, and multiple sclerosis. Hormonal erectile dysfunction is referred to the erectile dysfunction that happens as a result of testosterone deficiency or low testosterone, or in some cases as a result of thyroid issues. Psychogenic erectile dysfunction involves psychological conditions, that is, conditions that affect your thoughts, your feelings, or behavior. Earlier I said having erection is affected by your feelings too. So it's a type of erectile dysfunction when your erection is affected by your feelings, like it is affected by what you're thinking of. They can also cause erectile dysfunction. How common is erectile dysfunction? Erectile dysfunction is the most common sex-related condition that affects men, especially as they age and develop other health issues. The usual age for erectile dysfunction. Researchers estimate that erectile dysfunction affects over 50% of people who is identified as male, like those identified as real male, you get it, between the age of 40 and 70. Due to many people not talking about it, due to many male being sure about it, the only estimate that the researchers were able to gather up is 50% of male, and it's between the age of 40 and 70. The symptoms that shows in your body when you're experiencing erectile dysfunction: 1. Trouble getting erection before sexual intercourse, trouble keeping the erection during sexual intercourse, complete inability to get an erection, requiring a lot of stimulation to maintain an erection. If you're the type that has to use drugs, have to use agbo, all those your herbal concoction before you get an erection, you are suffering from erectile dysfunction if you're not careful. There are so many causes of erectile dysfunction, including conditions that affect your circulatory system, your nervous system, and your endocrine system. Conditions that affect these three systems that I mentioned. It's also a possible causes of erectile dysfunction. Your circulatory system includes your blood vessels that carry blood through your body. Your penis needs adequate blood flow to become erect and maintain an erection. So when your penis and blood flow is affected, to carry blood through your body is affected, you might have erectile dysfunction. Nervous system includes your brain, your spinal cord, and your nerves. They all work together to send electrical impulses that helps your body move and feel, including your penis. So if those systems are affected, you can also have erectile dysfunction. Your endocrine system also includes your glands, the glands that create and release hormones. Those hormones help tell your body to perform certain function. Testosterone may help open up your blood vessels, which helps blood flow to your penis. If this gland is affected, it can cause erectile dysfunction. There are so many conditions, so many diseases that can also cause erectile dysfunction. Like I said earlier, underlying condition can cause erectile dysfunction, like diabetes. If you're suffering from diabetes, you have diabetes-related neuropathy, you might have erectile dysfunction. You have hypertension, high cholesterol, vascular disease, chronic kidney diseases, atherosclerosis. You're suffering from stroke, epilepsy, low testosterone, you might have erectile dysfunction. Injuries to your penis and surrounding areas can also cause erectile dysfunction. This may include penile fracture, injuries to your pelvic bones like your hip bone, your sacrum, and your tailbone, your bladder, your prostate, and spinal cord. You can have erectile dysfunction. If you have pelvic surgery before, including prostate, colon, or bladder cancer surgery, you might have erectile dysfunction. You are undergoing radiation therapy, you might have ED. Some medication can also cause erectile dysfunction. If you are using some medication, you can also have ED, because ED is a common side effect of many prescriptions drugs, antidepressants, diuretics, anti-anxiety medication, your blood pressure medication, your antihistamines, your chemotherapy drugs, sedative, muscle relaxers, prostate cancer drugs, anti-seizure medication, and so many other medication can also make you have erectile dysfunction. Substances that have addiction potential may also cause erectile dysfunction. Substances like alcohol, amphetamine, cocaine, marijuana, opioids, nicotine, methadone, and barbiturates. They can make you have erectile dysfunction, especially if you are addicted to those kind of drugs. You may suffer from erectile dysfunction. This substance can affect and suppress your central nervous system. They can also cause severe damage to your blood vessels, which may lead to permanent erectile dysfunction. There are also psychological and emotional conditions that can also cause erectile dysfunction. They are depressed, anxiety, stress, fear of sexual intercourse or intimacy. It is called genophobia. Low self-esteem, they can make you have erectile dysfunction. Factor of erectile dysfunction: if you are age 40 or above, you can suffer from erectile dysfunction. You have diabetes, your BMI is over 25, they are overweight, have erectile dysfunction, you have depression, you are physically inactive, you smoke a lot, you can have erectile dysfunction. How do you manage erectile dysfunction? The first step in treating erectile dysfunction is identifying the underlying cause. Your doctor will help you determine the best treatment for your erectile dysfunction. There are so many treatments. The treatment that is best for you will be the one that your doctor will ask you to undergo. We have cardiovascular exercise, we have quitting smoking, talking to a sex therapist, oral medication, vacuum constriction device, testosterone replacement therapy, penile implants procedures, so many treatments, so many medical treatments that a doctor will have to put you under depending on what your underlying causes is. There are so many questions, like some common questions about ED. Some people may ask, will this erectile dysfunction go on its own? Erectile dysfunction will not likely go on its own without changes to your lifestyle or some kind of treatment. So it's that you go through some treatment or you change your lifestyle completely. That's where maybe erectile dysfunction might go. How do you prevent erectile dysfunction? That you have to have lifestyle changes. You have to reduce cholesterol level in your body. You have to be physically active. You have to maintain healthy weight. Get high quality sleep. You have to make sure you rest a lot. You stop smoking by the time that smoke. You reduce or stop drinking alcohol totally, and make sure you eat healthy food. So we'll be looking at the nutritional intervention of erectile dysfunction, how we can use nutrients to manage erectile dysfunction. The nutritional management focuses majorly on improving your blood flow, your hormone balance, and overall cardiovascular and metabolic health. There are so many things you have to focus on when you are managing erectile dysfunction. Your nutrition dietitian may put you on Mediterranean diet. And Mediterranean diet helps to improve your blood flow, your endothelial function. It lowers the risk of metabolic syndrome, cardiovascular diseases. Mediterranean diet is rich in fruits, vegetables, whole grains, legumes, nuts, fish, and unsaturated fatty acid like your olive oil. Foods that are high in antioxidants are also very important in managing eating. Examples of foods that are rich in antioxidants are your fruits, your vegetables. They help to reduce your oxidative stress and improve nitric oxide availability. Dark chocolate also contains flavonoids that may enhance circulation. Omega-3 fatty acid is also very important in managing eating. Fatty acid reduces inflammation and improves blood vessel function. The sources of omega-3 fatty acid is your fatty fish like your salmon, your mackerel, your sardines, your flaxseed, your walnuts. They help to reduce inflammation and improve blood vessel function. Zinc and magnesium is also very important. So you opt for food that are rich in zinc and magnesium like your beef, your pumpkin seed, your spinach, your almond. They support testosterone production. There are also nutrients. If you are deficient in it, you can have eating, such as vitamin D. It is a low level of vitamin D is also associated with eating. You can get your vitamin D from sun exposure, your fortified dairy, your supplements. They can also help in replenishing the ED that you are deficient in. D-complex vitamins also helps your nerve function and circulation. There are also some foods that you have to limit or avoid. Processed food. You are suffering from ED. Processed food is not your friend. Processed food are high in trans fat and sugar. They increase inflammation and damage your blood vessels. Alcohol is not your friend. Excessive intake can reduce testosterone and impair nerve function. Caffeine is not good for your health. In moderation may help, but excessive intake can increase anxiety, which worsen erectile dysfunction. Red and processed meats are linked to poor vascular health. They are linked to poor vascular health. If consumed excessively, it can affect your erection. Lifestyle. Your way of life also affects your erection. If you're the one that is obese, you have to maintain a healthy weight. Obesity increase ED risks. You exercise regularly. Exercising regularly improves circulation and testosterone levels. Quit smoking. You smoke, quit it. If you're the type that smokes a lot, it can affect your erection. It might not affect now, because some people smoke a lot and they be like, I'm still I can still but one day to affect you. Smoking damages blood vessels and reduce blood flow to the penis. Stress. Chronic stress or anxiety can cause or worsen erectile dysfunction. So please make sure you manage your stress. It is very important. To manage erectile dysfunction, you have to follow all these nutritional interventions, this nutritional management. Lifestyle changes is also very important when managing erectile dysfunction. And it's a wrap for today where your health matters. We brought this video to this level and say thank you. And I want to believe that I've learned one or two from today's video. Share this to your friend, tell a friend to tell a friend about this channel. Or this channel, they are all about you. Yes, all about you. Give you everything that you need to know. You have a question or you have something particular topic that you want to know more about, you can drop it in the comment section. I'll be willing and eager to tell you about it. Today's topic is something that one of our subscribers actually asked us to talk about, and yeah, we deliver. So if you also have something that you want us to talk about on this channel, you can send it to the comment section. Thank you so much for watching to the very end. See you next time. Bye bye.